Turning to this now, Charlotte's newly formed Safety Council Committee met for the first time today.
And now one of the main topics we're hearing about centered on how mental health connects to crime and what the city can do to address this. WCNC Charlotte's Jesse Pierre live outside of the Government Center in Uptown tonight. And Jesse, what are city leaders saying specifically to this?
Well, city leaders say that public safety doesn't stop with policing, that it includes mental health care, housing, and community support. They also discussed efforts across the city and county that can better work together to prevent crime before they happen. Charlotte's Safety Committee officially at work, tackling one of the city's biggest challenges, mental health and public safety.
We fully understand as a committee and as a council that public safety doesn't necessarily equate to law enforcement solely.
Committee members say more people entering the justice system are struggling with mental illness or substance abuse. An arrest isn't always the right answer. The conversation comes in the wake of high-profile cases like the deadly stabbing of Irina Zarutska that raised concerns about public safety and mental health intervention. Chairperson Dante Anderson says it takes a layered approach.
We heard a lot of discussions around juvenile diversion and juvenile programs, alternative to violence programs, both on the street in the 3 areas that we do it in the city, but also hospital ATV programs that we currently have now.
City leaders say many programs are showing progress, but expanding them comes with a cost.
It's really a financial problem. We need more funding for the DA's office. We need more funding for our judicial system. We need more funding for our mental health support. And all of that comes from the state.
CMPD Chief Estella Patterson says better training for officers can also make a difference, especially during first contact.
I do agree or feel that all of our officers should be CIT certified, have that baseline at least, that if they encounter somebody that is exhibiting some characteristics of mental health issues, that they can at least mitigate it until we can get further assistance to help them and get those wraparound services that they need.
Committee members say prevention starts long before police get involved.
So we have to educate our community on what mental health challenges really are, and then how do we begin to intervene as you heard the conversation around interception at that 0 point before there is an arrest or an offense or a crime made.
City leaders say the next step is a strategic meeting happening later this month where they'll further discuss some of those programs, see what is working, what should be expanded, and also address funding gaps. Live in Uptown, Jesse Pierre, WCNC Charlotte.
Jesse, thank you.